to the 5th Info Days of the EU Cancer Mission. The Horizon Europe Work Programme 2025 has been published on the 14th of May. At today's session, we will present you the core topics we have included under the Work Programme 2025 for the Cancer Mission, which will continue to support its implementation. Before presenting the topics, we will give you an overview of the Cancer Mission and also an explanation on the project clusters. There will be also a presentation from our colleague from the Health and Digital Executive Agency, HADEA, giving you an overview of the Cancer Mission Work Programme 24 results. The recording of the event will be then also available on YouTube. I'm confident that today's program will help you greatly to better understand the new concept of the EU mission, as well as the topics in 2025, and that should help you to prepare your possible applications. I now hand over to Matthias Schuppe, who's Deputy Head of Unit B1 Cancer Health and Policies in DigiSanté, for a few introductory words from his side, working on the Euro-Beating Cancer Plan. Over to you, Matthias.
Thank you, Annika, and good morning. Indeed, I will give you just a few pointers on the cancer plan. As you are probably aware, the plan was adopted in 2021 and similar to the cancer mission, covers the entire cancer pathway. And both cancer plan and the EU cancer mission work in tandem to bring together science and public health. There are several examples or many examples where the cancer plan and the mission mutually support each other. And this includes also personalized cancer medicine and pediatric cancer. And these are the areas that I will briefly touch upon in my presentation. So in terms of personalized cancer medicine, the focus is on the deployment of new technologies, computing capacities and data infrastructures, which will, for instance, enable AI-driven research and innovation activities. On the side of the cancer plan, one example for such action is the European Cancer Imaging Initiative, which develops a pan-European digital infrastructure for cancer-related images. This infrastructure will then be leveraged to develop AI tools towards personalized diagnosis and treatment. Also, this year, we are launching a new direct grant to member state authorities, what we usually call a joint action, with a focus on personalized cancer medicine. It aims at increasing the uptake of cancer personalized medicine and genomics across the EU. This action will build on projects that are already being implemented under the cancer plan in the area of the action on cancer diagnostic and treatment of all initiative. Now moving on to pediatric cancer, which is a cross-cutting topic for both the cancer plan and the cancer mission. Since 2022, the cancer plan's EU network of youth cancer survivors connects childhood, adolescent, and young adult survivors. The Cancer Mission has launched a dialogue with these young cancer survivors to better understand their specific challenges and needs to inform research actions. So you can see that the cooperation between the Cancer Plan and the Cancer Mission is quite tight and crucial to continue both the implementation of the Cancer Plan and the Cancer Mission under the new mandate. And with this, I hand over back to Annika. Thank you.
Thank you, Matthias, for helping for the introduction and making the link to the policy initiative of the EU Commission on Euro-Beating Cancer Plan. Now, let's move on and invite my colleague here with me in the room, Kay Dagen-Walls from the Cancer Mission Secretariat, to give you a short overview of the EU Cancer Mission and including also the project clusters. So over to Kate.
Thank you, Annika, and good morning, everybody. I'm going to give you a brief overview of the cancer mission. So, as you know, the missions are about challenges, and the challenges that we have in cancer are that 2.7 million people in the EU are diagnosed with cancer each year. 1.3 million people die from cancer, and the total cost of cancer in Europe in 2018 was 199 billion. And all of these statistics are set to rise. There's also the impact of COVID-19 pandemic and the war in Ukraine, which has delayed diagnosis and treatment. And as you know, the goal of the cancer mission is to improve the lives of more than 3 million people by 2030 to prevention, cure, and for those affected by cancer, including their families, to live longer and better. And we work very closely with Europe's Beating Cancer Plan. And we have 4 mission objectives: understanding cancer, prevention and early detection, diagnosis and treatment, and quality of life. And there are 19 research and innovation priority areas, and there are 5 transversal areas such as equity, childhood cancer, personalised medicine. So the timeline for the cancer mission is from 2021 to 2031. And to date, we have awarded funding of 488 million. And then if you look at some of the concrete actions that the cancer mission is involved in, we have 3 flagships: the OnCan data platform, the European Cancer Prevention Centre. The concept has been rejected by the member states. And then we have a network of comprehensive cancer infrastructures which have started, and the Cancer Patient Digital Centre, a blueprint for this was also published. And we're creating synergies at EU, national, regional and local level. And the research and coordination support, 61 projects have been launched so far. So as I said, the cancer mission, the Europe's Beating Cancer Plan, of close linkages, sort of linking research with cancer public health. So the cancer mission is part of the Europeans Beating Cancer Plan, and it's a key pillar of a strong European health union. And the mission supports its implementation and links research and innovation and policy. So this is done by generating scientific evidence in the area of understanding, prevention, diagnosis, treatment, and quality of life. So there is the scientific advice mechanism, which is given advice for the cancer screening guidelines. We're engaging with European citizens, including patients, and then the establishing national cancer mission hubs in member states and associated countries to the ECHOS project. And the first national cancer mission hub was launched in Poland on Tuesday. And then, as mentioned, we're supporting 3 flagship initiatives. So some of the achievements from the cancer mission, we're boosting research and innovation actions at EU level and enhancing research capacities at national level. So there's been an investment of 488 million in 61 R&I projects across the 4 mission objectives, and 99% of the total mission budget has gone into R&I. So some examples of projects that have been funded: we have 12 research projects to enhance understanding of cancer development, 18 to test innovative approaches to prevention and screening tools, 17 international pragmatic clinical trials to optimize diagnosis and treatment have been started, and there's a focus on the quality of life, and there's been a dialogue with young cancer survivors and policy reach out on palliative care. So the overall cancer research portfolio across Horizon Europe has given an investment of 2 billion, and there are synergies with other projects such as the Innovative Health Initiative, EIC, EIT Health, and other Horizon programs. And we're building synergies with the EU Health Programme, creating the OnCan platform to boost availability, use and reuse of research data, and then increasing research activities of the comprehensive cancer infrastructures to a capacity building programme which is supported by the CCI for EU project. And then we're engaging with the European Investment Bank to support widening countries to develop comprehensive cancer infrastructures. So this is just to let you know the projects that have been funded so far, the calls that have been in the cancer mission since the start. And this is brings you right up to the 2024 topics which have been recently funded. So it just gives you a snapshot of all the projects that we have in the cancer mission. So we're linking European, national and individuals in the cancer mission. So we're engaging citizens and stakeholders on cancer research and innovation. So we've a dialogue with young cancer survivors, which was launched in 2023, and this informs research and policy needs and shaping of a dedicated mission topic on addressing side effects. So this was in the 2024 work programme. And as Matthias has said, there was also a topic in the EU for Health programme. The bus roadshow was a pilot which started in 2024 in 3 countries, and it was in Poland, Lithuania and Romania. And it demonstrated a huge potential of community-based initiatives to promote behavioural change. And it's a meaningful way to promote prevention by engaging citizens directly. There's been a broad mobilisation of cancer research in health communities with 66 partnerships created to amplify the impact of mission actions. And we've started a communications campaign in 2025 to increase outreach and engagement of stakeholders. So just to let you know about some events that are happening or have happened, as I mentioned, there was the launch of the Polish National Cancer Mission Hub on Tuesday, and this also coincided with a Cancer Mission Thursday. The Cancer Mission is organising a conference together against cancer through research and innovation on the 17th of June in Warsaw, and there's the link for the registration, and there will be live streaming available. The Cancer Mission will also have a session at the Osaka World Expo on the 26th of June, and it's to be confirmed yet whether live streaming will be available. And the CCI for EU project, they're having their 3rd and final conference, Effective Patient Pathways, on the 15th and 16th of October in Madrid, but the closing date for applications is the 30th of June. And priority will be given to delegates from CCIs with the low maturity. And there's the link if you want to apply, or any of your stakeholders want to apply for this conference. And we have published our 3rd mission newsletter, and the link is there. So just to remind you, I suppose, of the project mission clusters, we have set up a number of clusters, and in the topics you see that you're required to join a cluster if your project is successful. So in January, we launched 2 new clusters, the one on prevention and early detection of heritable cancers for the projects that were funded in 2024, and then one on quality of life as well for the projects from 2024. So these clusters are working very well together, and many of them are on to their 2nd annual meeting, and they've developed videos and information sheets. So all of them are available on the project websites. They have links to the clusters. And just to let you know that we organise policy webinars based on these clusters, and we've organised 3 so far. And the aim is to bring together stakeholders and citizens' perspectives on research and innovation and collaboration within the cluster to make better use of the project results. So on the 4th of July, we had the Understanding Cluster Risk Factors and Determinants policy webinar. On the 10th of December, we had Prevention Early Detection, which focused on screening. And then in April, we had the Prevention Early Detection Cluster again, but which focused on implementation, research and behavioural change. And all of these policy webinars have projects from the EU for Health projects, the Cancer Mission, national projects, Horizon Europe projects as well. So the next webinars are planned for the cluster diagnosis and treatment and the quality of life. And these will be in the quarter 3 and 4 of 2025. So thank you for your attention.
Many thanks, Kay, for this comprehensive overview. What's the mission about? What has happened? What's the investment so far? On the investment on the work program, so we thought it would be interesting for you also to learn about the results of the last work program, 2024, what are the results. Projects are just about to start. So this is that I invite Yannis Volders from Hadea to give us an overview. Over to you, Yannis.
Thank you, Annika, and good morning to everyone watching us online. It's a pleasure to join the event today. We can move, please, to the next slide. Introducing briefly Hadea, the European Health and Digital Executive Agency, with a vision to boost Europe by building from Earth to space a healthy society, digital economy, and a competitive industry, reflecting the programs delegated and trusted to us for the implementation. We can move next, please. And this mirrors in this slide the overall budget trusted to us, amounting to nearly 20 billion euros for the current framework program. And you can see on the left side of the pie the dedicated fractions for the EU Mission on Cancer, the Horizon Europe Health Cluster, and the EU for Health program, all exclusively dedicated to health, either public health or research and innovation. And we can move next, please. Given the next slide, please. Given the time limitations also, but I find it important to highlight that beneficiaries of Hadea that actually can reflect any of you participants joining us online or the partners that you would like to put together in the proposal that you are going to submit. It reflects a broad range, including industry, research institutes, academia and university, affiliated hospitals, international organizations, national, regional, local authorities, civil society representatives, and NGOs. And you can see the variety of this organization, beneficiaries, and we move next, please. And here I'm going briefly to outline, as Annika mentioned, the 2024 call topics and the results. You have seen also from my colleague Kay the full overview, and here you have the specific on the 2024 call. And my point is that you can see it touches in different areas of the whole mission architecture, from understanding to prevention and early diagnosis, detection, to diagnosis and treatment, and quality of life pillars and areas. And we move next, please. And in this table, you can see also the cumulative, the detailed and cumulative figures that we had 12 retained for funding. That's meaning successful proposals out of the total of 90 submitted, and this and a total indicative budget of 119 million euros. I'm very glad to say that the proposals have just completed the grant agreement preparation phase, meaning that they have signed all 12 of them their grant agreement, and so this gives us now the nice freedom to outline them publicly in detail. So we can move next, please. And before doing that, as usual, please, here you can have a look to the trends and on the overall participation data among EU member states in the graph that you can see. And 2 points I'd like to mention: the usually 5 more higher participants you can see reflect Spain, Greece, Germany, Italy, and the Netherlands. And also in this year, 24, you can see that we have participation from all EU member states except for one. And concerning the associated third countries, you can see that United Kingdom, together with Norway, Turkey, and Ukraine, but also Switzerland and Canada had successful participations. And we move now to see the funded proposals that as we've just said, they are becoming now 2 projects. And very soon, because it was matter of days, this update, you will find detailed information to the dedicated EU Codis platform. Very quickly, from the understanding area, you can see the Juncker Connect and Candle funded projects. They have to do with Juncker platform and coordinated by Estonian and Dutch coordination organizations. And we move next. From the early detection area, you can see that we have SEALD, Predi-Lynch, and DISARM from Slovenian, Norwegian, and Greek organization focused on tackling pancreatic cancer, the Lynch syndrome associated to many types of cancer, including colon and among others, and disarming the silent threat of ovarian cancer. Concerning the clinical trial program, you can see that we had a French organization in a kind of novel topic managed by charities. And we move next. Concerning the equality of life area, you can see the two topics 05 and 06. Concerning the first one, you can see a range of Irish, Greek, Spanish, Swedish, and Dutch organizations coordinating late effects on adolescents and young adults. We have one topic, one proposal, Transcend GXR, focusing on testicular cancer, whereas the rest, they focus on all cancers, and you can see with a strong also AI component, as for example in late AYA. And last but not least, we have the EU SIP proposal funded project coordinated by Sarité in Berlin. Please, yes, that's it. Thank you. We move next. Stay in touch with us, all channels of communication and our social media. And I would like to close my intervention by wishing success to your ideas and application. Thank you.
Thank you, Yanis, for this interesting, well, it's not look back, it's now starting, but look back at the results. So now, before we explain you in more details the topics of Work Program 2025, we warmly invite you to show a bit, you know, your interest, your ideas. So that's why we have the Slido polls. Please, I'm sure you're familiar with, you scan the code to enter. So go into the Slido website and use the code #missionsinfoday. Then you need to select the session Cancer Mission, which should be right above, to be able to participate in the polls and also to ask your questions later. With the first question, would like to inquire, which other areas do you think should be funded under the EU Cancer Mission? So what do you think is missing? What could be enhanced? So which other areas do you think should be funded under the Cancer Mission in the future? So we wait a moment for you to connect and launch your ideas before we look then at the results. And while sending us our results, I would like to prepare you that we will also have a second question. And to prepare that, we would like to ask you which core topics you're most interested in. So core topics of Work Program 2025. So that's the second question. First, what are the areas, research areas you feel should be funded under the Cancer Mission? So while we are waiting for the results, so I repeat the question, please connect to Slido, #missions info day, select cancer mission session to be able to answer these questions, but then also later to have your specific questions related to the 2025 topics. Now I hope we can see the results soon. And the first question was, which other areas do you think should be funded under the cancer mission? So first question we would like to have your feedback on. Here we go. Okay. Now the results are coming. I hope you can see it. So unmet research needs, yes. Diagnostics, early diagnosis, cancer cachexia, genetic prepositions, AI, yes. Radiotherapy, somebody's missing innovation, tech innovation, early detection, life after cancer treatment, so quality of life issues, vaccines, yes, prevention, translating preclinical findings to early clinical trials, patient's experience. So we see the list is growing. There's still a lot of ideas. Survivorship, chronic disease, cancer as a chronic disease, targeted therapies, quality of life that we had already in many aspects, which also includes long-term monitoring of cancer patients, late effects. All right. So many thanks for that, for this little warm-up. Let's move to the second question, which asks you specifically in which of the topics, before we present them, are you most interested in? So please give your vote to that before we then move to the presentation of the topics. So here we have the list of topics, and we see participants are participating in the poll. So let's wait a little moment before we project the results. Okay, I think we have quite some participation. So here we go. While we got still replies coming in, it seems at the moment that topic number 3 on innovative surgery attracts the most interest. But I think the other topics are catching up. Also, the understanding of effects of environmental factors is an interesting area. So these are the top 3 of our topics. So, very good, but it seems quite equal distribution of interest. That's good to know. So, please finish your voting. It gives us a nice idea where you place your interest now. So with that, and we are very much on time, that's great, because we want to have plenty of time for you to ask your question. But now I invite my colleagues from the Cancer Mission Secretariat, who are connected online, to present us the 6 core topics of Mission Work Program 2025. So we start topic by topic. And after the presentation of all 6, you will then have plenty of time to raise your questions. So starting with topic number 1. Yes, here's shortly that the closing date for the applications will be the 16th of September 2025. So topic number 1 on sustained collaboration of national regional cancer funders to support the cancer mission through transnational research. So I call on, oh no, I'm too fast, very sorry. There's a brief overview, which is very important for you to take note on, which is partly included in the topic text, and this is presented now by Angelo.
Good morning, everyone. Thank you, Annika. So I will just briefly give an overview of few issues about the portfolio, project cluster, citizen engagement, and then user involvement that are commonly part of many of those topics. Proposal, as usual, would be evaluated on scientific merit. So you can follow the usual rules of the evaluation criteria that are set for Horizon Europe projects. Proposal may have exception to procedure, and those applies only to selected topics, and those exceptions are detailed in the box under procedure. And the portfolio approach is there to make sure that the list of selected projects actually cover all the elements that are specified in the topic text. So more explanation will come later on those specific topics. Usually the topics ask to involve professionals and let's say in general actors that are coming from other disciplines and sectors beyond the business as usual of Horizon Europe projects. Then many of the topics require to foresee some budget for networking activities. Proposal do not need to write the details of those networking activities, because those will be added during the grant preparation, and are usually actions that are needed to participate and interact with other projects within a given project cluster, as explained before, as mentioned before by Kay. Citizens, including patients and caregiver engagement. This is something that is often mentioned in the topics. We refer to civil society, patients and caregiver organizations, and more in general communities, and those should be consistently addressed in the proposals. Please avoid focusing on a limited number of patient advocacy organizations. More in general, mission topics include end-user engagement. And here we give some examples of end-user engagement for using participative research models and services. And those examples are coming from different member states. For end user, we refer to citizens, cancer centers, national and regional health authorities and services, local communities, like, for example, schools, cities, etc. So this is quite a wide definitions of end user. And as I already mentioned, the closing date is the 16th of September. So with that, I think we are ready to go to the first topic. So the first topic, topic 01, is a sustained collaboration of national and regional cancer funders to support the cancer mission through transnational research. It's a coordination and support action with a budget and an expected EU contribution of 5 million. The indicative number of projects expected to be funded is 1, and the financial setup for the grant agreement is lump sum. This topic contributes to the achievements of the mission objective understanding. Next slide, please. So the expected outcomes of these topics, national and regional cancer funders across Europe, therefore representing the north, southern, central, and eastern, western part of Europe, base a common strategic research and innovation agenda to deliver at least 4 transnational calls for proposals addressing translational cancer research that are in line with the cancer mission and the Europe's Beating Cancer Plan, resulting in collaborative grants to academic investigator-led third parties. And second, streamlining national, regional, and foundation-based or charity-based practices in organizing peer-reviewed translational cancer research and innovation funding between partners. And here the expected outcome is also the attention to exploring novel funding schemes and initiatives, as well as the sustainability of the network of funders. So let's see now at the scopes. Next slide, please. So the scope is to align and coordinate and support efforts between national and regional public and private research funding programs on translational cancer research to issue at least 4 joint transnational calls which are integrated with the cancer mission and the Europe's Beating Cancer Plans. So those networks are required to pool the necessary financial resources and when appropriate to leverage resources from other sources like foundations, charities, and transnational initiatives to support those 4 joint transnational calls for proposals. Please note that the EU contribution will not be used to co-fund those grants to third parties. Third point in scope is to demonstrate the potential impact of collaboration between national and regional transnational research and innovation programs, as well as demonstrate a leverage effect on European and national research and competitiveness using key indicators. Applicants should consider novel funding schemes and joint activities, like, for example, the analysis of research and innovation funding programs, their impact, dissemination, involvement of citizens, of course, including cancer patients, etc. All the data sets that are produced in those collaborative grants to academic investigator-led third parties should be made fair, so fundable, accessible, interoperable, and reusable whenever possible, while tools and models should follow the principle of open science, taking advantage of the services that are already offered by the European research infrastructure, and they should support the future Uncan.eu research data platform. Next slide, please. Okay, let me move now to topic 02, is understanding the effects of environmental exposure on the risk of pediatric, adolescents, and young adult cancer. This is a research and innovation action with a budget of 30.2 million. The expected contribution per project is between 6 to 7 million, and the indicative number of projects that are expected to be funded is 5. This topic contributes to the cancer mission objectives by improving the understanding of the impact of environmental exposure. And these include also the interaction with other relevant factors, like, for example, socioeconomics factor, on the cancer onset and progression, and/or other relevant health outcomes along the whole cancer patient journey. Next slide, please. So what are the scopes of this call? The applicants should address several of the following activities: to identify, validate, and document different types or combinations of biomarkers for the development of measures that are robust and possibly quantitative on the effects of cumulative environmental exposure associated with cancer onset. They should elaborate and test cost-effective approaches for measuring biomarkers of cumulative environmental exposure in large pediatric, adolescents, and young adult populations, and they are free to apply new analytical tools and novel methods of analysis. Identify individual signatures that, for example, can be based on genetics or epigenetics, or more in general, multi-omic characteristics, as well as the time windows conferring susceptibility to environmental hazards that are associated with cancer onset and progression in children, adolescents, and young adults at different stages of the life course. And then a scope for young patients. So identify clinical states, lifestyles, and socioeconomic factors and circumstances that increase the risk of adverse health outcomes that are associated with exposure to environmental hazards in different time windows in young cancer patients. Finally, develop new tools and methods to combine and analyze multimodal data, including the application of new data-intensive methods of analysis. At the same time, those methods should be interoperable with the future Uncan.eu research platform and should take advantage of current European research infrastructure services. Next slide, please. So the expected outcomes of this topic are that the researchers and health professionals will advance our understanding on how environmental genetics and epigenetics, and more in general, omic and other factors interact in determining the onset and the development of cancer in children, adolescents, and young adults, and how they impact health outcomes in young cancer patients. Policymakers and public health authorities will have scientific evidence to improve prevention strategies in order to minimize the impacts of environmental factors on the development and progression of pediatric, adolescents, and young adult cancers. Research innovators and professionals from across different disciplines and sectors will support and contribute to the future Uncan.eu research data platforms by ensuring interoperability of data and by making available there new digital tools and models. So thanks. Next slide.
Yes, thank you, Angelo. So now we move on to topic number 3, and I hand over to Gianpaolo Soriano for this and also the following topic. Over to you.
Thank you. Good morning, everyone, and welcome also from my side to this Info Day. So I will take now 2 topics in a row, and both focus on clinical trials, where obviously the scope and the target group is different. So let's start with the first one. So it's the Horizon Mission 2025-02 Cancer 03. Title is Innovative Surgery as the Cornerstone of Affordable Multimodal Therapeutic Interventions Benefiting Cancer Patients with Locally Advanced or Metastatic Disease. So 2 key aspects here, innovative surgery, and then the target group, which is cancer patients with locally advanced or metastatic disease. It's a research and innovation action with an overall budget of 31 million, which should enable funding around 3-4 projects with a budget size between 7 and 10 million. As we always say, I mean, this is indicative. The topic, I mean, this topic as well as the following one contribute to the specific objectives of the specific objective treatment and diagnosis and treatment of the cancer mission. Next slide, please. Now, this one, yeah, that's fine, thanks. One more, okay, yeah, thanks. Okay, I don't know, it's jumping up and down, but you know, if you can put the one with the scope. Okay, great, thanks. So why surgery? I mean, surgery is it represents really the main first line of intervention, in particular for solid tumors. Now, there is a lot of innovation ongoing in this field, innovation that for which, you know, this particularly target group or this particular population group that is being targeted by the study is somehow underserved. I mean, when it comes to patients with locally advanced or metastatic tumors, their participation in clinical trials is quite limited. Hence, the idea behind this topic. The focus is on the validation of innovative surgery-centered multimodal treatment intervention, as I said, for patients with locally advanced or metastatic disease. As indicated, when appropriate, investigators should consider minimally invasive surgical treatment intervention combined with other either medical devices or multimodal treatment. You will see in the call text there are footnotes with a list of either surgical type of intervention or then you know, other therapeutic approaches. I just want to stress, I mean, that these are given for as example. I mean, the list is by no means exhaustive or yeah, compulsory to follow. I mean, that's there for, I mean, to provide some indications. Now, another important aspect which is highlighted in the call text is that the type of, I mean, for the clinical trials, those should be academic investigator-initiated clinical trials, where the translational research that is supported by the topic would be only for the implementation and the analysis of the clinical trial. For the trials, data should be disaggregated by sex, gender, age, and other relevant variables, such as measures of socioeconomic status and ethnicity. And importantly, when it comes to the primary and secondary endpoints, so looking either at overall survivals or then patient-reported outcomes or other aspects of quality of life. I mean, these should be defined together with patients themselves. This is to push end user engagement and participative research models, as indicated also earlier in the initial slide. Another important aspect is that the chosen intervention should be indeed adapted to the specific needs of the target population, but also reflecting then the specificities of the healthcare system in the cultural diversity and available resources in a member state and associated country. That is a very important point. As you see, in fact, the call text explains, also requests that affordability of the chosen surgery center treatment should be demonstrated by a cost effectiveness analysis. In the topic test, you will also see there is a description of the specific requirement of having a multi-stakeholder approach, obviously, and there again, a list of type of stakeholders is provided. You see there on the screen as well. I mean, again, this is only indicative. And the last point, that is linked to the European health data space, and in particular, I mean, then the making available the data produced by the clinical study also through the futureandcam.eu platform. Next slide, please. So taking that into account in terms of expected outcomes, then patients would have access to tailored, affordable, effective, and when appropriate, minimally invasive surgery-centered multimodal treatment intervention, targeting specifically, as we said, locally advanced or metastatic disease. The innovative surgery treatment, technology or medical device would be made available to researchers, innovators, SMEs, and other professionals for further improvements, and eventually national healthcare providers, policymakers, and authorities in European regions, member state, and associated country would have the evidence to implement affordable surgery center treatment solution targeting specifically patients with metastatic disease or locally advanced disease. Thank you. So that's for topic 03. Now looking at topic 04. If you can move on one slide, thank you. So again, as I said, I mean, this is also a topic that supports the implementation, the design and implementation of clinical trials. Here, accent on early stage clinical trials for pediatric cancer. Again, this topic falls under the objective diagnosis and treatment. Two age groups are targeted. So children 0-14 age at first cancer diagnosis, or then adolescent. So disease goes between 15 and 19. Because of that, we will apply to the topic a portfolio approach. It's a research and innovation action with an overall budget of 25 million, which should enable funding 3 to 4 projects with a budget between 6 and 8 million. If you can move to the next slide. So why this topic? I mean, when we look at the pediatric oncology, obviously over the past decade, I mean, there has been a huge improvement with survival rates that are very high, in the range of 80-85%. Yet cancer remains the leading cause of death in this population group. Also, and this is something that we have discussed already and addressed also actually in previous topics. Very often, children, adolescents treated for cancer develop what we call late effect or long-term effects due to the high toxicity of the treatment. This primarily reflects the fact that in terms of innovation, for therapeutic approach for this particular age group, actually there is a gap. Enough to see that if you look at the past 20 years, I mean, the drugs that have been authorized for pediatric use is actually, I mean, a very small portion of cancer drugs authorized in the market. This applies, I mean, to the therapeutic approaches, but also, to what we call the companion diagnostics, so what is used then to assess the efficacy or effectiveness of the treatment. So the topic then will support the design and implementation of innovative investigator-initiated multinational early-stage clinical trials, so phase 1 or 1-2, to accelerate the development of safe, effective target cancer treatment for, as I said, children or adolescents. Importantly, we focus on cancer with poor prognosis, which are defined here as cancers with an overall survival rate at 5 years below 50%, where any type of cancer is in scope. For the design and the trial, obviously all socioeconomic aspects and biological stratification should be taken into account. Data should be disaggregated by sex, gender, age, and other relevant variables. As I said, the topic also supports or requests the development of innovative clinical tools, or the companion diagnostic, to assess then tumor response, which should be tailored to the age group, and which then will enable, sorry, that's moved one slide, that's fine, provide evidence to deliver affordable and accessible treatment for children and adolescents with cancer in member state. And then the sentence that you've seen also in the previous topic related to the European Health Data Space and UNCAN. So next slide, please. So looking then at the expected outcome based on what I described before, then children and adolescents with cancer would have access to innovative, more effective, less toxic treatment, both in terms of acute and long-term late effects. National care providers, policymakers, and authorities in member state and associated country would have access to, would have the scientific evidence to accelerate the implementation of affordable treatment in their healthcare systems. And then researchers, innovators, and professionals would ensure accessibility and reusability of relevant trial data to support the future UNCAN data platform. Thank you.
Thank you, Gianpaolo. So without undue, we move on to topic number 5. Over to Dirk.
Thank you, Annika. Good morning. I would like to explain topic 5, which is about pragmatic clinical trials to enhance the quality of life of older cancer patients through nutrition. A total budget of 15 million euro is available so that we could fund 4 research and innovation action, each of them with 3 to 5 million euros. The topic will contribute to the achievement of the mission's specific objective, quality of life. Next slide, please. As outcome from this topic, we expect that older cancer patients benefit from tailored nutritional interventions in their treatments, because this improves the treatment and the side effects, which finally enhances their survival and quality of life. The topic will also give evidence to national healthcare providers, policymakers, and authorities so that they can better implement tailored nutritional care in routine cancer treatments and in everyday medical practice. Next slide, please. So now I would like to explain the scope of this topic number 5. It should be randomized or cluster randomized trials led by academic investigators, so not by industry, to validate tailored nutritional care, which could include also physical activity or psychosocial support. The target age group is older cancer patients above the age of 65. The trials should stratify the patients biologically and pay attention to sex, gender, age, and other relevant variables such as socio-economic status or ethnicity. The interventions should be adapted to the needs of older cancer patients, to the local, regional, national, or cultural specificities across the countries. Also, affordability and accessibility should be considered. the endpoints or target outcomes of these clinical trials should support overall survival, patient-reported outcomes, and quality of life issues. This should be defined together with older patients and their caregivers to stimulate end-user engagement and participation. The trials should engage a mix of different stakeholders, such as physicians, academia, patients, nutritionists, behavioral scientists, SMEs, insurance companies, charities, etc. All data sets should be described with metadata in line with the European Health Data Space, use current European research infrastructures, and be made available through the Uncan platform. Thank you. This is all about topic 5.
Thank you, Dylan. So we now move on to the final topic on the Cancer Mission Work Program. So topic number 6, presented by Kay, who will then also present the joint topic that we have with the cities missions. But first, topic 6, Cancer Mission Work Program. Sorry, we are muted. Very sorry for that. So first, I have to invite again Kay to present us the final topic, number 6 of the Cancer Mission Work Program, and then she will also present a joint topic that we have with the cities missions. So we start again. Very sorry.
Good morning again. I'm going to present the topic on supporting the network of national cancer mission hubs. And this is a CSA, and there's a budget of 11 million, and it's expected that one project will be funded. And the financial setup for this topic is lump sum. So the topic will contribute to the continuation of the work to support the creation of national cancer mission hubs in member states and in associated countries. So the national cancer mission hubs are being developed at present by the ECHOS project, and the first one was launched on Tuesday in Poland, and there are more to follow in Greece, Malta, the Netherlands, and other countries. So this topic will then support the networking of these national cancer mission hubs. So building on the first phase of the National Cancer Mission Hubs, the proposal will address all of the following, and there's a long list of things that this applicants would be expected to do. So you have to enhance the capacity of the National Cancer Mission Hubs in the member states and associated countries through knowledge exchange and training, and expanding the geographical outreach of the National Cancer Mission Hubs activities in each country. To support the network's work, such as coordination of joint activities of National Cancer Mission Hubs and awareness raising of the cancer mission activities, including coordination of EU cancer research activities and policy actions. Develop a methodology on mission-driven implementation of mission actions with the view to building synergies at national and regional levels. Support the engagement of relevant national, regional or local actors, including civil society, as well as business and legal advisors, including those who haven't been previously involved in setting up these national cancer mission hubs. And these would be involved in regular thematic policy dialogues and country-specific dialogues on cancer to increase the impact of EU cancer-related research and innovation and policies at national, regional and local level. And the applicants are also asked to organise regular citizen engagement activities, at least one per year, related to the objectives of the mission, such as on prevention, screening, or to organise activities for a country or a number of countries using tools and materials that have been developed by the European Observatory on Health Systems and Policies. And the European Observatory on Health Systems and Policies have run a number of policy dialogues, and they've developed lots of tools. So these would be run in each member state and associated country with a view to increasing awareness and participation in policy discussions. So continuing on the scope, the applicants are expected to develop strategies for national cancer mission hubs to reach long-term sustainability and to create a level of interest from stakeholders, including philanthropy, to attract private funding beyond EU programs in support of national cancer mission hubs. And also to disseminate the results of the National Cancer Mission Hubs Networks activities through organising a yearly conference and development of policy reports, provide a yearly summary report of national mission-related activities to contribute to the monitoring of progress of the mission implementation at national and regional levels, and to organise regular exchanges of best practices between National Cancer Mission Hubs and hubs of other missions, the other 4 missions, in the area of stakeholder and citizen engagement, long-term sustainability of mission hubs and building of synergies, and to work closely with the Horizon Europe national contact points to enhance their activities as well, such as raising awareness about the cancer mission funding activities through information events, info days, conferences, and so on, and communication tools, and to collaborate closely with Cancer Mission Board members to engage new stakeholders and to mobilise and align additional funding in support of national cancer mission hubs. And then to work closely with relevant international institutions and initiatives addressing science policy interaction relevant to the cancer mission, including relevant OECD initiatives aiming at strengthening evidence-informed policy making for mission-orientated innovation. And then finally, to establish appropriate collaboration with the consortium implementing Horizon Mission Topic 2024, which now the acronym is there because this topic has been funded, for joint activities such as dissemination and outreach related to national nodes of the European Cancer Patient Digital Centre. So the expected outcome is that the network and the National Cancer Mission Hubs are supported to ensure the integration of cancer mission activities at national, regional and local levels. And the stakeholders, including patients and citizens in national, regional or local health and research and innovation systems, engage in policy dialogues on cancer. And citizens, including patients, are involved in citizen engagement activities, and including their design and development, which will lead to recommendations being made to governments, helping to implement and adapt strategies to national and regional needs. And then regional and national policymakers and authorities benefit from activities carried out in the implementation of the cancer mission activities. So now I will go on to the topic that we're sharing with the city's mission. So this topic was discussed extensively in the city's mission info day yesterday. So the topic is about increasing walking and cycling to reap benefits, emission reductions, and integrate active mobility and micro mobility with smart technologies and infrastructure. So this is an innovation action, and there's a budget of 12 million, and the expected contribution per project is 6 million. So that it's expected that 2 projects will be funded. So there are a number of eligibility conditions, and these would be very relevant for the city's mission. So at least 5 legal entities, which are lead cities, and 5 legal entities, which are follower cities, must participate as beneficiaries. And each of these has to be established in a different member state or associated country. And in addition, at least half of the lead and follower cities beneficiaries must be among the 112 cities selected for the EU mission on climate neutral and smart cities. And the projects use satellite-based Earth observation, positioning, navigation, and our related timing data and services. Beneficiaries must make use of Copernicus or Galileo and other data and services may additionally be used. So there's a TRL of 7 to 8 for this topic, and again, it's a lump sum topic. And from the cancer mission perspective, the topic will contribute to the achievement of mission objective prevention and early detection. So this topic is a very, very long topic, and if it would be good if you looked at the recording of the city's mission. So, and I would only point out areas that are relevant for the cancer mission, I suppose. So, what the scope is that proposals are expected to address a very long list of things. So, and just the headlines is to improve the quality, safety, and quantity, accessibility, continuity, and effectiveness of walking and cycling infrastructures. And then it's providing an updated state of the art of the uptake of walking and cycling policies and programs. So here I've highlighted the health benefits from this, and much of this topic is about preparing cycling and walking infrastructures. But in the second bullet point, to improve integration and mobile share of active mobility. So part that would be relevant for the cancer mission is developing a case study to identify how walking and cycling can help to improve symptoms and quality of life of cancer patients, and also to test behavioural change regarding the uptake of walking and cycling among different populations through implementation research, and to address specific bottlenecks and barriers that prevent the uptake of behavioural change. And then just the last bullet point there is supporting the development of local, regional, and national active mobility policies and their implementation across cities participating in the action. So they want to lead to a 30% increase in the share of walking and cycling within follower cities and contributing to the implementation of EU-related policies, and in particular the European Declaration on Cycling. So the next bullet point is to use smart technologies and integration in traffic management systems, traffic light management at local, regional, and national level, including the new smart infrastructure. And the final bullet point is about coordination, exchange, capacity building for increasing the uptake of active mobility. So again, they're suggesting to involve a variety of actors, including local, regional, national transport, research and health authorities, and cancer charities are included here, citizen associations. These are the areas that where the cancer mission comes in. So the expected outcomes then are that cities advance in achieving their climate neutral targets, they increase the modal share of walking and cycling in follower cities, and in particular increase the number of daily trips on foot and by bike by 30%. And increase integration of e-bikes, e-scooters, etc. And as a feedback to EU research, health and transport policy, a comprehensive EU guidance on increasing walking and cycling and micromobility in cities. And then I've put there at the bottom to support and guidance for urban transport authorities to establish partnerships with relevant local, regional, national health authorities to promote active mobility products and solutions that demonstrate quantifiable health benefits for the city population, and in particular through implementation of research on cancer prevention by increasing physical activity and reducing obesity, and how walking and cycling can improve symptoms and side effects of cancer patients. So I think the advice would be, if you're interested in this topic, to attend the brokerage event and to get to look for those who are involved in the city's mission and the cities that are included, and to watch the recording of the topic in full that was done yesterday. Thank you.
Thank you, Kay, and thanks to the entire team of the Cancer Mission Secretariat for this detailed presentation of, I think, a very broad range of topics. So now we have time for your questions. Let me remind you to introduce your questions in Slido so that we then can show the question, and colleagues will then reply to them if needed. According to the number of questions and nature of questions, we'll group them. Experience show that often we can assemble them and give one answer to several questions. We will now have a short break for you to connect to Slido again and also gather the first questions and do a bit of sorting before we then launch the session of replying to your questions. So you have time during the entire question and answer time to pose more questions. So take your time, think about your questions. I'm sure you already have some in mind. We do 2 to 3 minutes break. Stay connected and upload your questions. See you in a short moment. So we are receiving many questions. Give us a short moment to sort the first questions out, grouping, before we start replying to those. So we'll show the questions on the screen. I will briefly summarize and then invite team members to reply. So a few seconds until you see the first questions coming in. So here we go. You see the first questions, and yes, very nice if you can point to the which number of topic. So Let's start with the first, I suggest, and since it's linked to the Uncanny U, I immediately ask Angelo to come in, and then colleagues be prepared then one by one that we can quickly answer these. So over to you, Angelo, to kick off the replies.
Okay, the question is on Cancer 02 topics. So to clarify if I guess the ANCAN implementing consortia should be involved directly in the proposal or contacted in advance by the applicants. It's not a requirement of the call to involve those that are already involved in the ANCAN Connect or the Candle projects. However, you are free to do this if you think that they can provide value to your proposal. And same, you don't need to contact in advance those consortia. This is part of the networking activities within the understanding cluster that will be defined during the grant agreement phase. So to summarize, you are free to involve them, but you are not requested to. And the networking activities, so the contacts will be defined during the grant agreement. Thank you.
Thank you. Next, Gianpaolo.
Yeah, thank you. Thank you for the question. I mean, this is a very general question. Before replying to any question, in any case, I would like to remind, Annika, I don't know if you mentioned that earlier, but we will provide then, we will draft a frequently asked question document, which will embed all the replies to the questions, those that we provide today, but also questions that are expanded. Obviously, there is a limitation of time now as to what we can reply. Now, on the specific question, on the design and implementation of the trial. I mean, obviously, the design is all the part that comes before actually implementing the trial. That applies to this topic as to the others as well. Here there is something important to consider that is linked on the one end with the innovative nature of the specific intervention that we are requesting, but also to the type of and the breadth of the consortium that we are expecting. So in the design part, all these aspects should be considered. In particular, you will see that in the call text we make references, for example, also to the early contact with regulatory authorities, for example, which should help, exactly in the design phase of the clinical trial, in particular linked to the, for example, to the feasibility. Thank you.
And I think you can continue on the question on pediatric cancer.
Yeah. Okay. The text of the topic refers to both age groups. So this is children, it says very clearly 0-14, and then children, adolescent 15-19. So these are the two age groups that are targeted. As I mentioned, and I didn't go into the detail, but I'm happy to do it now. For this particular topic, we will apply the portfolio approach. That means essentially that we want to ensure that both age groups are sufficiently covered by the proposal that we support. In other words, there is the option for applicant to go either for one single age group, so either children or adolescent, or both age groups. But at the end of the assessment of the projects, when the rank list will be defined, this will not only reflect then the scientific assessment by the quality assessment by the evaluators, but will also reflect in this portfolio approach. That means that we will fund at least one application that supports or that targets the age group 0-14, and one application that targets the age group 1519, provided obviously that these proposals attain the minimum threshold. And for the matter of the portfolio approach, applications that cover both age groups, so 0-14 or 15-19, so both age groups addressed in the application, will be considered as belonging to both age groups.
Thank you. The next question is related to topic 3. Can surgery be complemented by a treatment?
Yes, I think, I mean, this was explained also earlier, and is clearly indicated in the topic. For you know, while the focus is on innovative surgery, I mean, it says very clearly that this could be done, I mean, in combination with other therapeutic intervention, treatment intervention. And as I said, I mean, if you will see, I mean, in the topic test at the bottom, there is a footnote providing some guidance or some indications, I mean, of possible treatment interventions that could be considered. As I said, I mean, this is not prescriptive, it's only given as example.
Moving on, there was also, I think, a question to clarify on pediatric cancer related to topic 2, but it's also related to the other topic on the age groups. So as you, Angelo.
Thank you. So this question is if the proposal should I mean, if a proposal targeting only pediatric cancer is eligible for funding or not. The answer is yes. The proposals of topic 02 could target either all age groups that are of interest for this call, so including children, adolescents, and young adults. So up to 39 years, including 39 years at the of age at first cancer diagnosis. So they can include all of those age groups, or to focus on one of those age groups. So a proposal targeting only children cancer, or a proposal targeting only adolescents cancer, or a proposal targeting only young adults cancer are equally eligible. Thanks.
Thank you. So trying to keep up with the inflow of questions. One was first on the academic trials, whether or not SMEs working on drug discovery can participate in an application. So topic number 3, Gianpaolo.
Okay, you know, this applies to both 3 and 4 in the sense that, you know, in both cases, you know, we refer to investigator-initiated academic clinical trials. I mean, you will see and you will read very clearly in the text of both topics that there are references to participation of SMEs or industry in general. This is actually a very important point, you know, because while the expectation is indeed that the trial is an investigator-initiated and therefore conducted in that particular setting, the participation of private sector SMEs is highly encouraged. When it comes to coordination, I mean, in terms of let's say formal eligibility conditions, you know, there is absolutely no problem. An SME could coordinate the project. Obviously, you know, being these an investigator-initiated trial, maybe that's not the expectation, if we can say things in this way. But certainly, I mean, from a formal perspective, I mean, from a formal point of view, there is no limitation in that sense. Therefore, I mean, it would be then important to build properly the case and the application for the topic. Yeah, thank you.
Thank you. And this topic raises a lot of interest and questions, so you may want to continue also on translational research is limited, is pharmacokinetic, and let's include it in the scope.
Okay, without going really into the details, but the topic supports the implementation of a clinical trial where the focus is on surgery, innovative surgery. It is also clearly indicated that the translational part will only focus, will only support the implementation and the analysis of the results of the trial. As such, when the pharmacokinetic part is considered and as part of the implementation of the trial, that will be in scope.
Thank you. So I think we stay with topic number 3.
Yeah, I think I have already replied to
that
this
one.
question. Yeah, it's similar to the previous one. It doesn't mean that private organizations or private entities cannot participate in the topic or are not eligible. Quite the opposite. There is a specific requirement in the call, not requirement, but a specific expectation, in the call that private sector also participating. So if you have a look at the list of possible stakeholders involved, again, this is not prescriptive; it's only indicative. But SMEs and private sector is clearly indicated there.
Thank you. So topic number 5, the nutrition. What type of nutrition do you mean? For example, COVID has probiotics. That's for Dirk to come in and clarify that.
Yes. So this question is about probiotics. There was another question with other type of nutrition and also a range of nutrition. Well, I have to say we are not prescriptive here concerning the exact nutrition, so that there is freedom for the researchers and they can test any type of nutrition. However, you have to keep in mind that it's a competition and a group of independent experts will in the end carefully evaluate what you are proposing.
Thank you. Then I suggest we take the question related to topic 3. So do we need to focus exclusively on first-line treatment interventions? So back again to Gianpaolo.
Okay, do we need to focus exclusively on first-line treatment intervention? Again, the primary focus of the topic is indeed on surgery as first-line intervention for either locally advanced cancers or metastatic cancer. Say that it would be very important again to build properly the case in the application. Then go very carefully through the text of the topic. Try to address all the main elements that are highlighted in the topic against then which will then enable then a proper assessment also by the evaluators.
I think we start with this topic. It's very popular. So yeah. Go ahead.
Well, once again, there is no prescription in that sense in the topic, and I don't think there is any portfolio approach applied to this topic. So again, it would be all a matter of presenting the case in the application. There is no we have no prescription in terms of type of cancer that should be addressed by the topic.
Thanks.
So that's for topic 04 on the degree of interaction with regulatory authorities. Again, as I said, if you go through the text, you will see that regulatory authorities are mentioned at least twice in the text. So this is on the one hand, when there is indication of possible stakeholders to be involved in the topic, and then later there is a very specific sentence that says that early contact with regulatory authorities is important, is highly recommended. So there is no formal obligation to have regulatory authorities in the topic, but obviously, as I explained also earlier, in particular for the design phase, that's highly recommendable.
Thank you. And there's a general questions related to data to the Uncanny EU. We invite Angelo to clarify.
Yes, thank you. So this is about this sentence on data sets and let's say more in general on the digital assets that are produced in data-driven projects that we require that are made available through the Future Uncan platform. So the technical details on how this is going to work will be, let's say, communicated at a later stage, since the implementation of the platforms is not at that advanced stage. It will be by the time that the projects will start working with data during their project lifetime. So no need now to worry about those details. They will be communicated during the grant agreement phase.
Thank you. Then another question related to the portfolio approach, which is included in topic number 4.
Okay, I will give it another try. I explained earlier what the portfolio approach means here. I will try again so that becomes maybe clearer. But again, go back to the topic. Look, read carefully. That it's very much detailed and explained. The portfolio approach is linked in this case to the 2 age groups that are targeted by the topic. So that is age group 0-14 and age group 15-19, which, as I said, could be also combined in one single application. That's perfectly fine. Both age groups could be targeted by the same application. The portfolio approach implies that essentially when finalizing the rank list and therefore deciding on projects that should receive funding, beside looking at the quality, so that means funding the highest ranked proposal, we will also apply this portfolio approach. So that means specifically for topic 04, ensure that at least one application addresses fully the age range 0-14, and at least one application addresses fully the age range 15-19, provided obviously that this application attain the minimum score for funding, so the quality threshold. And again, applications that cover both age groups will be considered, as addressing both 0-14 and 15-19. I hope this clarifies.
Yes, thanks. Still on topic 3, I think it's a slight variation.
But this we have already replied, Annika, I think, no?
Okay, we have. So I thought so, but we're not sure. Thank you. Then let's move on. There's still many, so good. Related to topic 4, now it disappeared. So back, that's when it was. Yeah.
Okay, that's okay. Let's maybe go back first to the objective of this topic, which target, it says very clearly, multinational early stage clinical trials for pediatric cancer. Now, if you read, in the text of the topic, it is applicants are invited to consider indeed also participation of partners from countries beyond the EU. So that's very much welcome, which is also very much in line, as I said, with the scope of this topic, and the nature of and the particular target group in the focus of the topic. Obviously, participation of organization from third countries is will have to be done in line with the governing rules. So as you know, the Horizon Europe program is very much open to participation of third countries. Specifically, when it comes to funding, that will depend on the status of the the country, therefore whether or not associated to the country, whether or not eligible to receive automatically funding. So that's you will find this information in the general rules.
Thank you. Now you should see 3 questions related to topic 5. So I invite Dirk to reply to those as much as you see the need.
So the first one is, yes, of course, it's about therapeutic interventions. And what we say in the topic text is we want to optimize treatments and their effectiveness. It's not only improving quality of life, of course. So the second is about the molecular mechanism. We are not asking for this in the topic text. It's important that you meet the scope and the bullet points that we have in the topic, and there we don't say anything about the molecular mechanism. Of course, you can do this, but in the end, the experts will decide if you really meet the topic text or if it's going too far away. And then, there can be, of course, we are not prescriptive concerning the nutrition. I said this already. And of course, you can compare different diets, but you have to keep in mind that in the end, we want to see a validated, tailored nutritional care, and you also have to meet the other bullet points. So, and then there was a question also about the mechanism. I already said this. It's not the main purpose of the topic. And please try to meet the bullet points. And of course, the pragmatic trial is to evaluate the effectiveness of an intervention in a real world setting. This is important. You have to keep this in mind.
And then another question is related to topic 5 on how much translational research can be included in the Cancer 05 core.
Of course, we want to see a translation because in the end, we want to see a validated, tailored nutritional care. And this should be validated and adapted to the needs of all older patients. And well, this is all what we are saying.
Okay, so there was a bunch of questions on topic 5. We go back to topic 4. What is meant with early stage clinical trial?
Yeah. Okay, let's maybe again go back to the specific scope of the topic. You see in the text, we clearly, I mean, and already in the title, we put the accent on innovation and the necessity indeed to accelerate the development of new therapeutic intervention for pediatric and adolescent. In the light, of the current landscape. Early stage, reflects also that, and so these are all these elements together, reflect really this necessity to push for innovation. So on the one hand, the academic initiated or investigator driven trials, the multinational part, and on the other hand, indeed the early stage phases. That's clearly defined in the text. We specify the phases, so it's phase 1 and 1, 2. Sorry, maybe I'm taking too much time to reply questions.
No. I mean, these seem to not the most interesting topics, but raising most questions. There's one related to Transcan, other funder networks. So, Angelo?
Yeah. Yes. Thank you. Thank you for this question that I don't see anymore. But was about the if a network outside the existing Transcan can apply. Yes, it can. this is a competitive call. So if a network of funders that is not part of Transcan applies, it will be evaluated on a competitive basis. So it is eligible for participating to this call. Thanks.
And then maybe we have another question related to topic number 1. So the pooling of resources by national funders and charities.
Yes, so pooling of resources by national funders and charities, is there a minimum budget that participants should contribute with? No, there is not. This is the call. The call is not prescriptive on the minimum budget that those funders should contribute with when participating in forming this network. Thank you.
Thank you. Important clarification. Then now, still on the list, a question referred to the introduction of presentations. I was thinking of you, the partnerships numbers.
Yeah, Annika, I mean, I'm just interpreting. I don't know exactly if that's what is meant in the question, but maybe it was not your presentation, but the case presentation. I mean, the list of projects that have been funded so far. That's what I can understand. It's on 61. I don't know if that's what is referred to. But in any case, if you're interested to have a better idea of the type of projects that the Cancer Mission has funded so far, I would invite you to have a look at the Cancer Mission implementation page. You can just Google it, Cancer Mission implementation. And there you will find the full list of projects, with links to the short description and links to the specific web page that each project has developed. You will see there are references to the cluster, the work that we are doing with the clustering of projects. So all the information is there, along with a bunch of other useful information on other initiatives and activities that we are implementing. But again, I don't know if that was the question.
No, I think we just clarified here. It's a link to the broad mobilization of stakeholders, where we gave this precise number. I think it's through the bus road show and other activities that we counted the number of organizations that were part of our activities.
Okay. Okay, for that as well, if you are interested, still through the same webpage, you will see there is a specific link to the bus road show, where you also have details on the, let's say, the outcome of the implementation of the bus road show. There are some specific fact sheets where a number of stakeholders that have been involved in the implementation of the road show. That's I mean, when we say involved, I mean that means really in the implementation on the ground. This the bus went through 15 different cities in three countries. Therefore, we had a lot of support from local organizations, being it hospitals or a patients organization or research institutions. I mean that helped us in the not only in the in the whole really implementation, but also in all the preparation phase. Supporting us with the preparation of specific documents that have been then made available through the roadshow. But again, all this information is available on the website. You can have a look and.
Yes, indeed. And also on that website, you find a link where you can subscribe to our newsletter, which we have every 2 to 3 months. So that also gives you a broad range of information related to topics, but not only. There are many other activities under the EU Cancer Mission. Now let's continue. Some time is left. Again, topic number 3 and number 4 have more specific questions. So
I mean, on the first one, so the call topic mentions locally advanced and metastatic disease. What is the difference? I mean, I think we have explained this earlier, but we're talking about advanced tumors that can be either locally advanced, so that means tumors that are still growing in the body part where they have originated. They have maybe invaded local tissues and maybe lymph nodes, but they've not spread to other organs. or a distant part of the body, whereas, you know, the metastatic one, that's exactly what they do. I mean, they metastasize in other parts of the body. So I don't know, breast cancer that has metastasized in the bones, or yeah. And the second one, so what is required protocol maturity level at the time of submission? I mean, that's not something that we have specified in the topic, though. I mean, I think it's important to still keep in mind that we are, you know, focusing on early stage. We are putting the accent, as I said earlier, on the innovative aspect. So keep these elements into account when considering the maturity. But what is important also is that, you know, the topic itself will fund the design and implementation of the trial, which would be the main focus of the should be the main focus of the application.
Thank you. So going back to topic 5 on nutrition, this also receives a lot of interest. So over to Dirk.
Yeah, it's correct. The topic is mentioning physical exercise and psychosocial support. However, the main purpose is nutritional intervention, and the topic says you could include also physical exercise or psychosocial support, but it is indispensable to deal with nutrition. And the second question, yeah, it's correct. The topic 5 is not only about quality of life, also about the survival. And what is also very important, it's we want to optimize treatments and their effectiveness. And no, I don't see the question anymore. Yeah.
Thank you. So a few more minutes to go. We have a question related to topic 1. So Angelo, please come in.
So if a national regional funder does not participate to the call, can this national regional applicant participate to the 4 transnational calls? I'm not sure if I interpret correctly this question. So basically, the aim of this of the proposal should be to put together the funders to agree and issue at least 4 transnational calls that are on specific, focusing on specific topics that are aligned with the cancer mission and the Europe Beating Cancer Plan. So those are proposals that will follow the Horizon Europe rules, and I really don't understand this question. So a funder wants to participate in a scientific project, but not being part of the network of funders of this scientific project. So I think this should be clarified in written, really, so we can better understand what is meant here.
Yes, I agree. So don't hesitate to ask your question if not answered now during the session, or where we struggle to fully understand. Please submit this then in writing. We'll give you the links at the end so that you know where to post it. Then we have still a few questions, but very little time left. But let's take another 2 at this stage.
Yeah, Annika, I think this one I have already replied, 04.
Very good. So we can move on. We have topic number 6.
Yes,
okay.
You need your micro.
Yes, go ahead.
Okay. Yeah, this would enlarge, include regional authorities, because for the cancer mission hubs, we're trying to include anybody that has a say in cancer in any country, locally, nationally, or regionally. So yes, regional authorities would be welcomed to be included in this topic.
Short and precise answer. So leaving more time to another question related to topic 4, portfolio approach.
Yeah, there I can also be very quick. I mean, the portfolio approach is applied only to the two age groups, so 0-14 and 15-19. However, please bear in mind, that the text clearly specifies that the tumor, while there is, I mean, no specific tumor type is highlighted. We focus on poor prognosis tumors, with defined as overall survival rate at 5 years below 50%.
Great. So I'm looking at the hour, but yeah, there's, I would say, a final question on topic number 5 on the nutrition trials. Dirk?
Yeah, what is a pragmatic trial? It's to evaluate the effectiveness of an intervention in real-world conditions. This is the main purpose here. And if you deal with a mechanism, we are not asking for work on mechanisms.
Annika, I think we can take all the rest in writing. Anyhow, there are more questions coming in.
Yes,
so-
exactly. So I think a lot has already been answered, and so we take these questions as we have said, and we'll prepare also answers in writing, which we then will post on our implementation website. So if you Google Cancer Mission implementation, you should get on a Commission website where you find a lot of information, I mean, related to projects already started under the mission, also things we refer to in our presentations, the link to the newsletter. So I really invite you to consult also this website, which should provide you some additional information and background, also related to the topics, activities that has already been launched. So for that, I can slowly close our Info Day session today. But before I do so, I would like to remind you about the missions brokerage event, which will be held next week, 26, 27, online, and the NCP for missions, which will be on the 28th. So please, if you're interested, you will get these slides available and the links so that you can register. That's next week. I would like to first thank the team for the great efforts into preparing today's session, also those in the back office, and for answering many questions. But big thanks to all of you for your interest and active participation. As I said, there were many other questions, so we had to make a selection, but it doesn't stop with this session. We will have frequently answered questions published, also related to procedural aspects. You can always contact the Research Inquiry Service, through which we then also receive the questions and can come back to you. For many aspects, your national contact point can help you to prepare a proposal. So check the list on our website, which national contact point in your country is, your contact point. I've already drawn your attention to our website, which you have the link here also on our final slide. With that, we will finish our Info Days. We will promote it. You can rewatch the presentations and also share that in your network. So that would be great, so that we have many that are informed about the topics of our work program 2025. Thank you for your participation and looking forward to further questions if you have. Thank you. Bye.
Bye-bye.